But neurosurgeons, we don't get a second chance.
Second.
But for me, the most important thing is the brain is what makes us what we are. If I may just add, the brain and the spine are like the CPU of your body. So unless you take care of it, they are going to give you alarms. Because awareness itself is half the battle won.
Absolutely.
So these become important
So
red
some
flags.
warning signs or red flags, so to speak.
True. Second, a headache which is just not subsiding despite 15 days of good medical treatment. That becomes very important. Life-threatening diseases like brain tumors, accidents, strokes, which are very common nowadays. 3 mantras I would like to give. 1, keep physically active. 2nd, stay mentally curious. And 3rd, but sleep well. Acute or other emergency cases like operating for somebody with a very bad head injury following accident, or there are patients coming with bleed in the brain because of high blood pressure. And 3rd, commonly we see nowadays stroke patients who need acute surgical intervention.
I think most of our viewers probably don't know that you can treat a brain aneurysm by not even opening the skull.
So when a patient with a severe slip disc comes with so much of pain, and on the next day after operating, he gives me a beaming smile and says, my pain has gone away. That gives me a lot of satisfaction.
Because we have a lot of young generation probably in the viewers now, and avoiding toxins seems to be, I think, very important.
Because head injury is something which India cannot afford.
It can be life-changing and devastating
For the family.
For the family, for the patient, mortality. Welcome to Prime Talks. I am Dr. Hrushikesh Vaidya, Medical Director of Horizon Group of Hospitals. Also, I am a practicing pulmonologist and critical care physician. Please note that today's podcast is not an alternative for medical care, but only for educational purposes. Today, we are going to talk a lot about neurosurgery, and today's guest is Dr. Vishwanath Iyer, who is a consultant neurosurgeon at Horizon Group of Hospitals.
Thank you so much for having me, Dr. Hrushikesh.
Welcome, Dr. Vishwanath.
Thank you.
So, neurosurgery, we would like to discuss a bit about that. It is a very exciting and dynamic field. And I've heard a lot of young children wanting to say that they want to become a brain surgeon or a neurosurgeon. So can you say a little bit about that fascination in the general public about neurosurgery?
No, oft repeated statements like, I want to be a rocket scientist or a neurosurgeon. All of us have heard that. Probably that adds to the mystique and heroism of neurosurgery. But for me, the most important thing is the brain is what makes us what we are. And that is where the challenge and the fun of neurosurgery comes in.
Very nice. So as you said correctly, the brain is a seat of our consciousness, also seat of our emotions, seat of our, or the organ of our emotions, our consciousness, our physical ability, our balance. So everything, so brain being a very important organ, it is very important that we understand more about the brain and the functions of the brain and how to keep the brain healthy. And we are going to cover a lot of things today in today's topic, right?
So it is very unbelievable that Aristotle himself thought that brain is just the cooling agent for the heart. And it took many, many hundreds of years to realize the importance of brain being the center for consciousness and everything we do.
Of course, of course. So medical science has progressed a lot and we've understood a lot about the body and things like that. So great. I'm very glad we are having this conversation today, and I think our viewers will love to hear more about the neurosurgery and brain part. So let's start with the basics, that what exactly is neurosurgery and how the general public should perceive it as and things like that.
But neurosurgery, basically we cover any problems and conditions related to the brain, to the spine, the spinal cord, and the nerves. So basically, we are related to the electrical wiring of the body, if you can say that.
So the brain, the spine, the lower part of the spine, the lumbar spine,
yes,
and even the peripheral nerves, that comes into the domain of a neurosurgeon.
Yes, true.
Very nice, very nice. Okay. And most of the cases that you deal, there is a perception that neurosurgeons deal with only life-threatening cases. Is that true, or we are looking at a lot of, a mix and match of cases?
I would say by average, 90% of the work of a neurosurgeon today is more elective and planned. So we deal with a lot of simple complaints like low back pain, neck pain, arm weakness, slip disc, chronic spine degenerative diseases, life-threatening diseases like brain tumors, accidents, strokes, which are very common nowadays. These form probably maybe 10 to 20% of a neurosurgeon's typical work.
So there is a mix and match of emergencies, life-threatening and non-life-threatening
True
cases which a neurosurgeon treats.
Yeah.
Okay, very nice. So Dr. Iyer, you have given us an idea what kind of cases you see in the OPD, but what are your more cases that you operate and benefit the patients?
As a neurosurgeon, we do a lot of spine work. So in spine, the common cases are simple things like split disc or pain in the hand because of cervical disc problems, severe pain in the legs because of a lumbar disc issue, progressive difficulty using the hands because of chronic degeneration related to age. So spine surgery involves a lot of degenerative spine surgical work. In brain, the common surgeries we do are acute or other emergency cases like operating for somebody with a very bad head injury following accident, or there are patients coming with bleed in the brain because of high blood pressure. And third, commonly we see nowadays stroke patients who need acute surgical intervention.
Right.
So these form the main part of emergency brain work. And of course, elective brain work are more commonly tumors. So diagnosed tumors, we have to operate in a very planned and elective way. So tumors form a very important part of elective brain surgical work.
Okay, very nice. So Dr. Iyer, our viewers would like to know what they should be looking for in terms of their brain health. So how would you diagnose a brain tumor? And we would like to know a little bit more about brain tumor as far as are they always cancer or they can be non-cancerous brain tumor. So can you enlighten us a little bit about what should a patient be thinking when something crosses their mind whether they're having a problem?
True. I think it's a very important question because awareness itself is half the battle won.
Absolutely.
So if you are aware of symptoms of problems, you can pick them up earlier. So commonly you must remember that headache being a very common symptom, not necessary to investigate every headache. But if anybody has a headache which is unusual or never before in life, that's very important. Second, a headache which is just not subsiding despite 15 days of good medical treatment, that becomes very important. And third, any headache associated with other things like drowsiness, or you become very fatigued out, or if there is any weakness, numbness of one side of your body, or if there are involuntary movements of certain parts of the body. So these become important red
some
flags.
warning signs or red flags, so to speak.
True.
So to summarize, if a patient or a relative of a patient is having new onset headache, sudden headache, which we I think call thunderclap headache.
True.
Or headache associated with red flags such as weakness, seizures,
Yes.
or any other severe pain in the body, or stroke-like symptoms, then that would warrant a definite evaluation.
True.
And I think you would agree that in most of the cases, if early diagnosed, have better outcomes, right?
Yeah, I think early diagnosis, early treatment,
Of course.
definitely the results are much better.
Right. So once you diagnose, of course, the patients have to themselves understand that such warning signs are important for them to pick up, because unless they come to you or a hospital with those problems, we cannot diagnose and help them.
True that. I think that is why these kind of exercises which we are doing are very important.
Very
Because
important.
ultimately the people need to be aware of symptoms.
So awareness, early diagnosis, early treatment translates into better outcomes. So Dr. Iyer, our viewers would like to know, you being a brain surgeon, that what is the most satisfying part of your work?
I think two things give me a lot of satisfaction and give me a very happy feeling when I go back home in the evening. One, pain relief. So when a patient with a severe slip disc comes with so much of pain, and on the next day after operating, he gives me a beaming smile and says, my pain has gone away. That gives me a lot of satisfaction. And many times in brain problems, the patient has come with a one-sided weakness or difficulty using his legs, inability to walk. And when he goes back walking, he remembers it, and I am, of course, satisfied for life.
Absolutely. That sounds very exciting and satisfying. So what you're saying essentially is pain relief is one of your goals, satisfying goals, endpoints of your treatment.
Yeah.
And second is that if they are paralyzed, I think what you meant by weakness is paralysis.
Correct.
If you can cure them of paralysis by whatever therapy you can offer. Now that may not be possible in each and every case, But many times it's possible with proper therapy, I guess.
I think in today's world, going back to a functional recovery
That's
is
right.
very important. I don't think
Right.
any of us can afford to stay home.
Exactly.
So going back to a functional recovery is very satisfying for the patient, his family, and definitely for the treating team.
And you being associated with Horizon Group of Hospitals for so many years, we have seen a lot of patients recover from paralysis, from strokes, from brain tumors, and have a good, reasonable lifestyle even after that,
Yeah.
and have continued to live healthier lives than before.
Healthier, productive lives.
Productive
Dr.
lives.
Hrushikesh.
Exactly.
Thank you so much
Exactly.
for that.
So that's very interesting. Now, Dr. Iyer, many of our viewers would like to know that how much of technology is involved in delivering neurosurgical care. And we'll go a little step by step on this. When we talk about technology and then new things coming up, and let's go over that. First is the diagnosis. Now, you cannot diagnose a neurosurgical problem without doing imaging. Is that right? So, can you enlighten us on that?
I think it is now become such a very common thing to have good imaging that in my practice today, I hardly see a patient coming to my clinic without an accompanying CT scan or MRI,
Right.
which is actually a very good thing.
Great. So I'll hold you just right there. So when we talk about imaging in the neurosurgical arena, we are talking about either a CT scan or an MRI. So you need usually one of them to diagnose brain tumor, stroke, nerve compression, things like that. Is that right?
Yeah. So they definitely are both important and both useful for certain kind of indications. So if there is an accident case or you want quick diagnosis, probably an accident, stroke, or a bleed in the brain, a CT scan is more than enough. Generally, for elective cases like tumors, where you want more anatomical knowledge, more surgical input before you go to operate, an MRI is much more better.
MRI. So there are two different indications that a neurosurgeon will decide whether he needs a CT scan or MRI or both sometimes.
Or both sometimes, yes.
Very nice. Now, one point our viewers may want to know is that the MRI is not having any radiation. Is that right?
Yeah, MRI is a very safe diagnosis.
Safe
In fact,
diagnosis.
we can even do it for pregnant women.
Exactly.
Because there is no ionizing radiation in MRI.
So there is no radiation like X-ray or CT scan.
scan.
So
So it
even
is
a
a-
pregnant woman or a young child can safely undergo MRI without any risk of radiation.
Yeah, and now with the new, I think even in Horizon, we have this, a very less noise and very comfortable MRI.
So the experience
It's much
has
satisfactory.
improved over the years.
Yeah.
Right. So that's a very good point on diagnosis. Now, as far as the therapy is concerned, the technology used nowadays, we are talking a lot about AI, which is artificial intelligence. We are talking a lot about, using technology, using robots and things like that. So can you enlighten us about all these new things that are coming in neurosurgery?
I think neurosurgery has seen a tremendous increase in outcome, and in good outcomes, mainly because of the interplay between technology and the surgeon.
Very
So
nice.
if you really enter a good neurosurgical theater today, you will be amazed at the amount of machines in the OT. So we have advanced X-ray machines called C-arms. We have navigation systems which are like GPS system for us. So before we operate the brain, we actually have a standard operating protocol and we know what to expect.
So you know where the problem is so that you can address the problem
And
very
there are
promptly.
almost never any surprises on the theater.
Very nice.
Third, we have operating microscopes, which lead us with good illumination and depth, magnification. So basically, operating with good magnification and illumination reduces your chances of damage to the surrounding normal tissue. So operating with a neurosurgery microscope is now a norm when you're operating an elective tumor case.
So the technology has been evolved to the point where I think you don't operate without a microscope. I that's what I understand.
Most often an elective brain tumor, definitely we would not operate without a microscope.
Very nice. So the role of technology has evolved a lot, has helped patients, and is, I think, continuing to evolve.
It is huge. It is hugely evolving, mainly because ultimately in brain, every tissue of the brain is associated with some function.
That's right.
So we can't really afford to have even a millimeter of compromise.
Right.
And that is when technology helps us to improve outcomes. And literally, the outcomes are magical nowadays.
Very nice. Very nice. So if you have some young viewers who are not doctors in the group, what is your advice for them as far as choosing neurosurgery as a career?
It is, definitely it makes me happy every day that I'm a neurosurgeon.
Very nice.
It is a very long, focused and hard-working kind of career. So I think if you have big dreams, you will have to follow it up with good efforts and a lot of hard work.
Lot of hard work, lot of patience.
And
I think
in
your
today's
surgery
world,
is
I think you must always be very aware of technology. And I think the today's young generation is definitely
they are very
aware
savvy,
of,
I guess, with
So
that.
probably they'll be way better.
But I think the fact would be very important that they will have to have a lot of dedication. Something as a rocket scientist, that the same kind of dedication I think has to be there. The same kind of years have to go into practice and study and things like that, I
Yeah,
guess.
probably even rocket scientists may get a second chance, but neurosurgeons, we don't get a second chance.
Second chance. Very nice. So that was very interesting. Now, as far as improving the patient experience, patient outcomes in neurosurgery, I am assuming you need a team. So can you explain a little bit?
Dr. Rishikesh's team is a very, I would say we are like an orchestra.
Orchestra.
Yeah, it's like a musical orchestra where there are many players involved, and each of them is really very well aware of his role, both from the clinic OPD basis itself, where everybody has a role. In the theater, it's a very important part where anesthesia keeps a very important kind of, support system for us. So in today's world, even with a good, with a 6-7 hour surgery, sometimes we operate. But with good neuro anesthesia techniques, which we are practicing in Horizon Prime Hospital, the outcomes are so good that the patient wakes up after 7 hours without any pain. So pain relief is a very important addition to the armamentarium.
Very
so
nice.
Patient does not have to get only good results. He also should not remember the bad things like pain. So that is important. Fourth very important part is critical care. I would say neurosurgery theatre or neurosurgery hospital is incomplete without a very good critical care.
So the critical care team is very important as far as the post-operative prevention of complications.
Because most of the times the post-operative care is handled by the critical care team and by me together.
That's right.
We need to discuss the plus and minuses. And I think a good critical care team is very important for outcomes. And last but not the least, the supportive staff like the physiotherapist, the speech therapist, the swallowing expert. There are so many things which were not, given much importance maybe 20 years back.
That's right.
But in today's world, I would refer my patient for physiotherapy and, other therapies maybe on day one itself.
Day one itself. Very nice. So the teamwork is very essential, and that can give us a better outcome for the patient, I guess.
Yeah.
So Dr. Iyer, we are in an era where a lot of surgical techniques have turned from open surgeries to minimally invasive, or so to speak, keyhole surgeries. And I'm assuming those techniques have taken part in neurosurgical domain also. Can you explain a little bit about that?
So definitely these are called minimal access surgeries. So it is not mainly focused on reducing your number of stitches, because like I keep telling my patients, how many stitches you have on your skin really doesn't matter. Minimal access is for improvement in functional outcomes. So basically we try to reduce the corridor for entering when we are entering the skull for a brain tumor, or we are entering the spinal column for a spine problem. So mainly by using support systems like microscopy, endoscopy. Sometimes we are doing a lot of work in the cath lab, like how the cardiologists have been doing for many years. That is called neurointervention. So basically you can treat problems in the brain from your thigh via the femoral artery.
That's amazing. I think most of our viewers probably don't know that you can treat a brain aneurysm by not even opening the skull. That's amazing.
So that is something really wonderful, and it, patient literally can go home next day.
And
many of them don't even remember that they really had a procedure.
Right. So I think it is very important for viewers to know that neurosurgery has evolved in a very good way, and a lot of things can be done by a neurosurgeon in a minimally invasive fashion. Like we said, the aneurysm, which is a dilatation of a blood vessel, can be treated without even making an incision on the skull.
Yeah. So we take a small puncture in the femoral artery.
That's right.
And we have access devices. So we go from the femoral artery in the thigh to the brain. And we can treat many vascular diseases in the brain. Similarly, microscopy, endoscopy. So the advantage of these minimal access techniques is that the post-op recovery is much faster. The pain is much lesser. And the go back to a good functional and even go back to work time is very, very less.
Right. And one thing, as you mentioned, is many elderly patients can tolerate these procedures much better than open surgeries. So
I think the definition of elderly, I think every year the elderly definition is
absolutely,
getting pushed.
absolutely.
So in
Yeah.
the last so many years, I've treated patients with 70s, 80s, 90s. I've been lucky to treat a couple of patients even in their hundreds for brain surgery.
We have seen that.
Yeah. I think ultimately it is more important the physiological and the medical condition of the patient. I don't think anybody's age should keep them away from surgery.
Surgery.
If the surgery can give them back few more years of functional and productive life
As
with
you
their
as you
families.
pointed out, the lifespan is one thing and the health span is another thing. So we want to keep them on a higher lifespan and higher health span also, right?
So the quality of life is important. I'm
Quality
sure
of
they
life.
would like to spend some more years with their, kids and grandkids
In a healthy,
in a
healthy
healthy
fashion,
in a healthy fashion.
pain-free fashion.
Yeah.
For our viewers, I think a lot of focus has been on prevention. So how do we keep our brain and spine healthy from a preventive aspect? So we don't even have to ever have problems. So can you enlighten us on that?
I think for brain, 3 mantras I would like to give. One, keep physically active. Second, stay mentally curious throughout your life. And third, which may sound like a very small thing, but sleep well.
Sleep well.
So
Okay.
these 3 things are very important. Physical activity keeps your body pushed with oxygen and nutrition and also improves the blood supply of your brain. So your problems like cognitive deficits because of aging and memory problems and so many things can be either prevented or pushed into the future.
So as you said correctly, the exercise has shown in scientific studies to reduce the incidence of dementia. Is that right?
Definitely. Physical exercise has got a direct link with good mental,
Mental
abilities
health.
for a longer
So
time.
we see a lot of patients now in their elderly years having dementia.
Yes.
So potentially this can be prevented by regular exercises. Yeah. So that's from the brain standpoint, and learning new things, I guess, and avoiding
I think
toxins
this
are, I think,
curiosity should never die. Even if you probably retire from your official work, you can continue to read a book every day or play some Sudoku, solve puzzles, meet friends. Social interaction has got a very important role in a good cognitive life.
So I think, as you said, the body exercise is important. So muscles, your heart, and all that. But the brain exercise, I guess, that can be similar.
Yeah.
That you keep your mind active.
And you must cultivate a good social life.
Social life is important. Looking forward to meet people.
Yeah.
Avoid too much phone, I guess, and
Very, very important.
very important.
Very important.
And now let's just focus a little bit because we have a lot of young generation probably in the viewers now, and avoiding toxins seems to be, I think, very important early on in life. So avoiding toxins such as tobacco, nicotine, cannabis, I guess these are known to have triggered brain issues. Is that
They are
right?
definitely very detrimental for the brain. And I'm sure as a medical expert, you also are always telling your patients about how to prevent and how to minimize exposure to these toxins.
So what we tell the patients is definitely avoid smoking, definitely avoid drugs, definitely don't do any other harmful physical activity. And what we tell patients is to keep alcohol in very much moderation, because alcohol being a drug has acute issues also, like getting into accidents and things like that.
True.
And also chronic issues like, brain injury, dementia, all these things can, liver problems, which can again trigger brain problems. So I think for our viewers, it's important to know that avoid alcohol, drink moderately, drink responsibly,
Yeah.
right? And so because we are talking now about prevention, so that's the focus. And I think one important change I've seen over the years is the government's initiative of the helmets.
Yes.
And also the seat belts. Now we know a lot of prominent people also, had some issues for not wearing seat belts. So these are protective things that they can do daily to prevent problems.
I think in my own practice, I've seen a significant reduction in my neurosurgical trauma surgeries. And that I would give the credit to the government for making, seatbelts compulsory,
Absolutely.
helmets compulsory, very strict protocols about alcohol and driving. So these are very important things to minimize, because head injury is something which India cannot
It
afford.
can be life-changing and devastating
For the family.
for the family, for the patient, mortality, things like that. So our viewers would like to propose to minimize alcohol, minimize toxins, avoid drugs completely, and exercise their brain and their body as well.
Yeah,
Is that
I
right?
think just to add, spine. So now I have
Yeah,
a lot of
spine.
patients coming into my OPD with back pains, and many of them are very young. So I think two reasons for that, which I see many young patients coming with back pain. One is bad posture, sitting on the computer or the screen for too long in a day, and second, which I see very often, is trying to be too fast in gym activity.
Okay.
So gym injuries have become very common now.
Sports
Literally, I would
injuries
say every
being-
week I see a young man with a very bad back issue, mainly because of not doing the gym activity properly.
So again, we want to be healthy, but not overexert, overdo things, and result into injuries. That would be important. Maintain a healthy posture. Now we are talking about spine health.
Yes.
So I think that's very
So for
important.
spine health, I guess, sitting is a big problem. So if your job involves sitting, you must remember to get up every hour, take a small walk, say hello to your friends and come back.
That's right.
So don't sit for too long. Maintain your core strength, by doing regular daily exercises. Maintain your posture well and engage in some sort of a sport at least 2 or 3 times in a week.
Very nice. Very nice. Now, little bit on personal and lighter side. We know that you are a extremely avid cyclist. You have achieved a lot in that field as well. I would like you to give us a little bit insight on that and how it helps you to lead a healthy lifestyle and things like that.
Thanks for touching that topic, Dr. Hrushikesh. So I've been cycling for more than 14 years now. So I think it is my morning dose of meditation which keeps me physically very active. My legs, my core, my body remains strong. It keeps my heart,
Absolutely.
status in very good control. And it also, I think, gives me a focus to keep my day in a better way. So after doing my morning dose of exercise, when I come back at home, I'm more geared up to handle my neurosurgical day
That's
in a
right.
much better way.
Very nice, very nice. So we would encourage our viewers to take up some sport and be regular. If not, they don't need to excel in that, all of them. But I think be regular and take that daily dose of exercise or weekly dose of exercise, so to speak, so that they can have a very healthy, productive life as far as their all organs, including the brain. Is that right?
I think consistency is the key to any, physical exercise. Most of us will start something and not be consistent. So ultimately, you must choose an activity which you would fall in love with, and that will help you with your consistency.
So as we said, being a neurosurgeon needs consistency, having a healthy lifestyle, longer health span, lifespan, everything needs consistency. And I think we would encourage our viewers to be consistent with what we have discussed today, try to follow those things and lead a very healthy and a very happy and a very functional life.
If I may just add, the brain and the spine are like the CPU of your body, the central
Absolutely.
processing unit. So unless you take care of it, they are going to give you alarms. So it's might as well you start investing on the brain and spine from a very young age.
Absolutely. So thank you, Dr. Vishwanath, for coming on today's show. It was very interesting and enlightening. And I think this will definitely help our viewers to lead a healthy and productive life.
And thank you so much for having me here. I think spread of information is a very important part of a doctor's life. So I think this is a very good exercise which you're doing, Dr. Hrushikesh.
Thank you so much. Thank you.